Mackenzie McMahon is an entrepreneur with a background in health behavior science and public health. She has been with OsteoStrong since 2018 and has played a key role in expanding the brand across 5 locations in 3 states, overseeing more than 100,000 sessions. Mackenzie is passionate about helping people take a proactive approach to their health through strength, nutrition, and sustainable lifestyle changes and habits. As a business owner, he focuses on creating meaningful wellness experiences and building strong, supportive communities. Hi,
Hi.
thank you for coming, and I look forward to our discussion.
Yeah, thank you
Go
so
ahead,
much
give
for
us a little
having
bit
me.
about your background and how did you land this beautiful venture?
Yeah, so I started at OsteoStrong originally in Connecticut. I was hired as the manager at the location, and I just always wanted to be in health and wellness, and I just loved nutrition. I could talk about it for hours,
Mm.
and just making people feel better. So when I saw the position up for the manager of the OsteoStrong in Connecticut, I like absolutely I need to be here. And then it just so happened that they were just opening up the location. So I was at the opportunity of not only being a manager for the first time ever, but also helping the two owners open up the 2 locations in Connecticut. And then they brought me on as a partner in to expand into New York City and here into Naples, Florida.
Okay, amazing. I mean, you mix two beautiful things: the entrepreneurship and the the health and wellness at the same time. And I think, and I have a passion for both. So I was very intrigued when we first spoke, and you told me about what you do and your background. And it took me a while to understand. She saying that she opened 5 locations, and then later on, I mean, how impressive what you did, and most importantly, what you guys do at OsteoStrong and utilizing lifestyle and natural things really without jumping into crazy pattern medications and interventions to help people and help their lives. So, tell us a little bit about OsteoStrong itself. What does it
Yeah,
do? And tell us about the workflow. How does that work?
absolutely. I would love to. So OsteoStrong in general is an amazing biohacking company. So we really want to improve your overall skeletal strength. And everyone's so busy these days. So as fast as we possibly can, so you can get on to the next project that you have going on. Um, so at OsteoStrong, you use our patent devices to load heavy weight bearing force onto your body. So what we do at OsteoStrong is skeletal stimulation. So it's very different than your traditional gym and working out. You only come to us once a week. Every time you come in, you work with a session coach. And basically, we go on the vibration plate. So that really helps activate the body and get us ready for the session. We walk you through each one of our 4 OsteoStrong devices, and each one is designed to build optimal bone and muscle growth in a specific part of your body. Um, OsteoStrong itself has been around. The first one opened in 2011 in Nebraska. I always like to
Interesting.
say now you have a fun fact about Nebraska.
Mm.
um, and we are in over 14 countries now. So
Wow.
the company has expanded quite a bit.
Mm.
We're one of the largest biohacking companies in the world, which is very exciting. And it's been an honor to be able to be the one to bring here to Naples, Florida, which is, I believe, rated one of the healthiest cities, towns in the US. So,
There's quite a bit going on here from the
yes.
health perspective. People are very health conscious, whether young and old. And, from what we do, I mean, saw that this is very popular, quote unquote, biohacking. This is a popular thing here. And being in Florida, sunshine and all obviously helps. So,
Yeah.
okay. So,
Absolutely.
walk us through a patient or a client comes in. What do they, how long do they stay there? Their experience, and importantly, outcomes. What do you see and how do you monitor?
Yeah. So, first, someone will usually find out about us once they get a bone scan,
Mm.
whether it's a DEXA scan or a REMS bone scan, which is a newer type of scan in the US. And so first they're like, what the heck is osteoporosis? Like, what
Mm,
do I do from here? And then they'll usually, the algorithm works its magic and they find us. And then I jump on a phone with them to see if it is a good fit for them and to see if they're able to qualify to do our program. And then they come in and basically you're greeted by our team at the front. You'll check in. We go through just different like wellness assessments to make sure that we can personalize your session to the best of our ability. Um, we start on a whole body vibration plate, which has incredible influence on muscle activation, hormonal health, flexibility, bone mineral density. So we'll just start there for just 1 to 2 minutes to just activate the nervous system. We'll do some stretching, always guided by a coach. And then we go through each one of our four osteogenic loading machines. And so each machine is designed to build optimal bone and muscle growth in a specific part of your body. So the first machine is going to strengthen your wrist, elbow, shoulder, clavicle, pectoral muscles, everything in the upper body. What's cool about how OsteoStrong works is that everything, it gives you biofeedback in real time. So there's a tablet, it has all of your personalized information. So what's been proven is for each part of your body, you need a different amount of force loaded onto your body to naturally stimulate osteogenesis, the development of new bone tissue. And so on each machine, the tablet will tell you exactly when you hit that threshold, depending on your weight, height, age, every one of your biometrics. So your coach will always guide you to make sure that you're in the perfect form. We put you in the most natural form that your body is designed to absorb high impact in. Once we're in that perfect form, we'll have you slowly press onto the device. Once your coach can see that you're at the highest amount of force that you're capable of producing, we'll have you hold it for like 5 to 10 seconds. And that holding portion is really where all the magic happens. It's where your body starts to really recognize what's going on. It will send different adaptations to your body to stimulate osteogenesis, stimulate your osteoblast cells. And then you slowly come off of it and then you go on to the next machine. So you're really on each machine for like 60 seconds at the end of the day. It's pretty crazy. The second machine is going to strengthen your hips, femoral neck, knees, ankles. This machine itself has helped people push back knee replacements, completely cancel knee replacements just from how strong the joint and the structure of your lower body is getting. So we have the lower growth trigger. This third is the core growth trigger. This will strengthen your deep abdominals and your rib cage. I have a love-hate relationship with that machine, but it does wonders for you. And then the last machine is going to help strengthen your spine, the surrounding back muscles, help improve your posture, which is huge, hand grip strength, and your forearm strength. And after that, of course, each machine has a different threshold of force that you need to get to. But after that, we go back onto the vibration plate and we work on balance at the end of every session. And balance is typically the first benefit our clients notice an improvement in within the first like 4 to 6 sessions.
interesting. So you're not targeting only bone strength. You're targeting the balance, the joint health, which osteoporosis per se is not the problem.
Mhm.
It's a problem if you fall and break something, right?
Exactly.
So I mean, it's not just about strengthening your bone, but it's also about improving your balance, which is honestly genius
Mhm.
because you and I know, but a lot of people don't. Osteoporosis is cooking for many years. It's not just going to show up. And actually, if you never scan yourself and you never break the bone, you might not even know. Um, but it's going to take months, sometimes years, for you to see a meaningful difference. So, meanwhile, you're not going to just sit and wait. You're just going to improve your balance. You're going to improve your mobility and prevent that fall, which is outstanding. Now, let me ask you this. I'm all about prevention and the preventable. Obviously, I love the fact that we are using natural, non-medical part of medicine, which is becoming more and more popular today. But do you think, or do you have any clients who would walk in not having that bone scan, not having the fear of breaking a bone, and say, "Hey, listen, I'm at that age that I think I might develop osteoporosis. I want to prevent it." Is there a role for that? Do you see that? And what's your thought on it?
Yeah, absolutely. At the end of the day, OsteoStrong is a fracture prevention program. So exactly bringing in that prevention aspect of things. I like to say OsteoStrong only has good side effects, like improvement of balance, posture, muscle strength improvements, just overall condition. And so we do have quite a lot of clients that will come in mainly because either osteoporosis runs in the family, their mom had it, their grandma had it, and they just don't want to get to the point where their mother is at or was at. And so for that, we do have a lot of clients that come to us not for bone density reasonings. The end of the day, your muscles can't get stronger than what your bones can carry naturally. So we have in LA a bunch of Olympic athletes training with OsteoStrong. In New York City, we have two, and well, there's three in the city. I was involved in two of them. We helped a lot of New York marathon runners train, and it was amazing. We sponsored a few of them, and by whatever mile, when they were training, their knees would kill them, and they're like, okay, I just have to push through. And then after training with OsteoStrong for about 6 months up until the marathon, their knees weren't bothering them at all. They had a lot more endurance when they were running, and the recovery process after the run wasn't as terrible as it was beforehand. So there's a whole spectrum of people that we can help. A lot of people come to us for back and joint pain as well. So it's not just, everything stems from the skeletal system at the end of the day. So the stronger your foundation is, the stronger everything else is able to get to as well.
Okay.
I don't know if I answered that question.
You did. So,
Okay.
which I'm here going to be a little nerd. So, Jenna, you brought the genetics somebody had in their mom and their family, mom, sisters, grandma, they had osteoporosis or broke a hip. Because you got to be real. If you break a hip in your 60s and 70s, your life has changed forever.
Yeah.
And I mean, there are some lucky people, but most of the cases coming from traditional care system, I mean, we see them all the time. It is pretty bad, and mortality is pretty high, morbidity higher. So it is a real fear, and everybody's walking down the street scared they're going to have cancer or a heart attack. Nobody talks about hip fractures unless it happens. So going back to the genetic part of it, I always tell people, if you have the gene, you're not doomed. This is a classic example. So if you have the gene, first of all, in osteoporosis, the gene determines the maximal bone density you have, does not really determine how quick it's going to resorb. So let's say, at age 31 or 32, your maximum bone density, it's going to be in your favor if you have the gene for that, but it could be less if somebody does not have the gene. So the likelihood for the person who doesn't have the gene to develop osteoporosis is a lot higher, just because they have less bone to work with when they grow up. So this is where one of my favorite subjects, and I always talk about it, is the epigene, or the lifestyle factor of it, or because the gene cannot be adjusted. If you have the gene, you have the gene. There's, up until today, we cannot change it. There's a lot of experiments out there for it, but you can play with lifestyle, exercise, vibration, weightlifting. So I love the idea that people are walking into in the preventive world rather than trying to catch up. Because when you're trying to catch up and walk into this kind of field, there's a lot of emotional decision taking, and you are looking for immediate fixes, which is what medicine has taught us today, unfortunately. Western medicine has taught us that we're looking for immediate gratification, which most of the cases is not treatment, it's a patch. And we don't want that. We want to fix issues, and we want to fix it at the root. So doing what you're doing, like what I'm doing, get a lot of pushback from community, from peers. Tell us a little bit about that, because that's a frustration for everybody.
Yeah, it really is. And just how society is, we've just have been taught doctors are some of the smartest people out there, of course. We are just taught to follow that path and that path only. And there are so many other natural ways that you can actually heal the body and fix the body, and not even get to the point of you need to fix it. You don't, like, fixing isn't in your vocabulary because you've been working on it your whole life. And so with that, the the biggest pushback that we get from OsteoStrong really is that one, a lot of people are told throughout their whole lives that it's quite impossible to build bone density back. And every time I hear that from a potential client, it really infuriates me because it has been proven time and time again that you actually can build bone density back and just prevent the loss at all. We get a lot of pushback from the fact that OsteoStrong is only once a week for 15-minute sessions. But although it's a short session, you are committed to it for quite a few months, about 18 months before you get another scan. And just in general, the pushback of what, like natural healing or OsteoStrong in
Yeah, I mean,
general.
you're doing this instead of doing medicine, right? I
Hmm.
mean, they make you feel like you're not doing yourself a favor, conspiracy theorist. And I see this all the time. People walking into my office are always frustrated with the usual traditional healthcare system, with the pushback they get. So we're just continuing to talk about osteoporosis.
Hmm.
Of course, you can build bone back because bone, the misconception out there is bone is not just lost. Bone is built and lost all the time. So as you grow and as you age, your bone is going to be built and destroyed. And this is what is called bone remodeling. So you're going through remodeling because if it's only getting built, you're going to have bone cancer when you're like 5 years old. So that's it's tremendous physiological process. And the more I read about bone and the physiology of bone, it's so fascinating. The amount of physiology and the amount of cellular changes and mitochondrial changes and the signaling that happens, the amount of molecules that are involved in bone and bone resorption and bone remodeling is just fascinating. So when somebody comes in and says, your only way of resorbing that is by targeting this little mechanism by giving you this shot or this injection or this pill, and I'm not disregarding them,
Yeah.
I think that they have a role, is honestly not short of ignorance. And doctors are guilty of that. And I'm a doctor, and doctors are guilty of uh, going always towards the prescription before saying anything else. The average doctor studies zero exercise, zero nutrition in their medical school and their residency. We're starting to see changes in more integrative residencies, but the vast majority of doctors, they don't know much about exercise or nutrition unless they taught them. And this is the only way of doing it. So the pushback you're getting is a real pushback. But as when we started talking, being in this part of the country, people are more open to these ideas. And it's not just an idea; it's something that works
Yeah,
really.
it's
So
proven.
yeah, yeah.
I
So
will say with that in Connecticut and New York City, I would go to a bunch of different like lunch and learns to try to educate the community on OsteoStrong because in Connecticut I was the first OsteoStrong there, in New York City I was the first OsteoStrong there, and in Naples I am. So education plays a huge role in that. And in Connecticut and New York, I we would get little to no doctor referrals or anything like that. They were just like, okay, we don't like we're too busy for this. But here in Naples, we get a lot of referrals from doctors and dentists actually, which is really was shocked me at first. And then it was fun to educate myself on why and the side
jaw
effects of
osteonecrosis, yeah, yeah,
exactly.
yeah.
But something that was nice, my mom went to her, her yearly checkup with her doctor the other day. And the only advice that the doctor had for her was you need to eat more protein and you need to do more weight bearing exercise. And that made me feel so good about maybe how the society is
Right,
turning more into being
right,
more
right.
aware of what you're
Yeah,
doing,
yeah.
not like, oh, you need to maybe up this medication that you're doing, or and supplementation is great too if you need the supplementation. But it was more of just go do more weight bearing and eat more protein.
Yeah,
And that
yeah,
was really nice for me as a daughter to hear. So doctor tell that to
yeah,
my mom as
yeah,
like,
yeah.
you're doing great. All you
No,
need to do
yeah,
is this.
absolutely, absolutely. Yeah, I mean, I have current clients who do believe about what we do, and a lot of the pushback comes from their family members that think that we're not doing them a favor by talking about exercise and nutrition, and they just want prescriptions. it's very frustrating, but as you said, it's changing, and the
Hmm.
society is changing, and we're seeing a lot into that field. So let me ask you this: you said once a week, so that raises a question for a lot of people. Is there a thing as a too much exercise and a too much work towards bone? That's something to worry about.
So for exercise is a tricky word because we try so hard to veer away from the gym, right? So we're a wellness center. We don't take the place of the gym. We highly recommend people continue to do their normal activities, weightlifting, Pilates, walking, whatever it is that they decide to do. At OsteoStrong, you're putting such a high impactive force loaded onto your body, and so how you're mentioning just like the bone remodeling, it takes at least 5 days for your bones to fully remodel and recover from the skeletal stimulation you're doing at OsteoStrong. So even us for traditional exercise, you know, listen to the normal recommended 3 to 5 times a week. But for OsteoStrong nationwide, we will always only do the sessions or the machines once a week. Even us working there, my team, we're very specific about what machines we demo the and just our sessions in general, so that because what you do, you'll keep interrupting the remodeling signal throughout your body. So it'll actually just prevent your results from happening sooner. You'll just kind of keep pushing them back because it keeps sending new triggers and your brain's like, oh wait, I thought I was doing this. I need to fully remodel from this positioning or this loading.
So no more, more is not necessarily better,
Correct.
right?
Yeah.
Yeah,
So we
yeah, yeah,
recommend doing it between 5 and 10 days, even. So
yeah, yeah.
if a client's like, "Oh, I can't come in next week," like that's
That's
totally
okay.
fine.
Yeah, yeah, that's okay. Yeah,
You're not going to reverse in any
yeah,
of your
yeah,
progress you're making with us.
yeah, yeah.
We actually have a lot of clients that come from Canada, and there's probably 2 or 3 OsteoStrongs in Canada, all in the same area. So most of our clients from there, they just do OsteoStrong the 6 months that they're here. And then when they're home, they don't have an OsteoStrong. And we've had clients who have done 2 consecutive years of season sessions here, and they were still able to see really great results in their bone density when they, one of our clients completely reversed her osteoporosis. I believe she went from like a negative 2.8 to it was like a negative 1.3, I want to say, in the span of the 2 years. And of course, they're doing nutrition, they have a healthy lifestyle outside of OsteoStrong. But it's just so nice to see that too. And it's nice to have that experience to kind of share with people when they're like, I'm missing a week. I don't know what to do. But it's like what you're doing is you're stimulating something within you. So
Exactly.
once you do that, it's not just going to go away. Whereas when you take the medication, it says when you stop the medication for the next 6 months, like you're going to lose a lot more than you gained in the
You're absolutely right.
time.
That is such an important point. So when you
Yeah.
look at the warnings for some of the medications, I'm not going to name any medications
Hmm.
not to get in trouble, but some of the stuff that you start, if you are lucky enough to go through the treatment phase without going through side effects, you have to bridge with another medications, or otherwise you're going to have a rebound effect, and you're going to lose a lot of what you gained, maybe even more. So that is if you're lucky enough to go through the whole process. Some medications, they have a side effect of a stroke or a heart attack. Well, hey, congratulations, you fixed your bone, but
Yeah.
you're not with us anymore.
Exactly.
So
Yeah.
yeah, it's yes, true that I see changes quite quicker on the DEXA scans with medications than exercise or estrogen. We'll talk about it in a sec, but um, it is a more lasting change, and it's slow and progressive, natural, minimal side effects. Any actual, as you said, side effects are
There.
positive,
Yeah.
right? So that's always good to hear.
Yeah.
So your typical patient or a typical client that come in, do you have first of all, is it just women or do you have some men? And what is the common questions that you hear from? I mean, obviously they're walking in there, they're looking for something.
Mhm.
Um, what are the common questions that you hear from them, and what what other advice when they leave there, when they leave the facility? What is your advice for them?
Yeah, so we do have mainly our clientele are women 50 and older. That's right when they get their bone scans. So
Mm-hmm.
that's when doctors start to talk to them about bone health. And I would say we do have more men here in Naples than we had in New York or Connecticut. I assume it's because we're just an active community and men want to continue to play golf here and they want to play pickleball and and maybe slightly their wife is pushing them to come in with them, but it's a nice thing that they can do together. Um, but with that, most of when people come in, the biggest questions we get are really, well, one, does this work? And I'm
Mm-hmm.
like, yes, there's
Mm-hmm.
many studies that show the efficiency. The science has been around since the 1800s for how you can remodel bone with weight bearing. And OsteoStrong is really just one of the first companies to really put that science into practice. But one of the biggest questions I get is actually about their DEXA scans. A lot of them are they just retrieve their DEXA scan from their doctor and no one really goes over it. They just kind of say, you have osteoporosis, you have to take this and like come back to us in 2 years. And so on the DEXA scan, a lot of our clients come to us with the concern that they have osteoporosis in their neck. So they're like turning really gently. And I'm like, well, it's in your femoral neck. So it's just like the lack of explaining what the
Mm-hmm.
actual parts of the DEXA scan is. I find myself, I'm not a doctor, so I'm not diagnosing them with anything, or I'm not telling them this is what you have. I'm just educated on reading what the scan says. And it makes them feel a lot better once they kind of have an understanding. And also, I know a lot of people don't really talk about the Z score, but that is a comforting explanation that I like to go over with our clients. 'Cause some clients are in their 70s but they're above the Z score of what the Z score, which is basically compares you to people of the same age and sex as you. They're right where they're technically supposed to be. So zoning in on the T score can be a little scary sometimes. So I think something I like to do is just find a little comfort in the system and make them not have as much fear doing things. That when people leave the doctor's office or something, they're usually very scared to do anything. I was on the phone with someone yesterday and she was like, oh, I took this medication last year and she couldn't get out of bed for weeks because of how bad her bones hurt and her joints hurt. And at the end of the day, like when you break your arm, you're not like, well, because a common question is like, well, I don't feel anything. Like, is anything happening? And I'm like, well, have you ever broken anything before? Did you feel it healing? You're like, oh, but it's almost healed. Like, you don't really feel bone. And osteoporosis is the silent killer disease, right? You don't feel any pain with the weakening of bone. So that's something I really like to stress is that paying attention to all the other benefits that you get from OsteoStrong, the balance, the joint pain, because at the end of the day, a T score is just a measurement, but like you're not scared of your T score, you're scared
Mm-hmm.
of what will happen because of that.
Right.
And that goes into the whole lifestyle component that you're talking about. It's the balance, the strength, the everything coming together that's going to help you not fall and fracture. Like your T score is not going to make you fracture. It's the fall that will make you fracture. And kind of,
Yeah.
yeah.
Yeah. Absolutely. So, you brought up the DEXA scan, and you also brought up the ultrasound.
Hmm.
A lot of people, they have fears of X-rays, although I do reassure a lot that the amount of radiation you're getting from the DEXA scan is minimal, and it remains the standard of care. But for people who are scared to get radiation, I mean, they maybe got a bunch of CT scans this year, whatever it is they have in their mind. Tell us more about the ultrasound testing.
Yeah, so it's a Echolight REM scan. It has been the golden standard bone scan in Europe for many years now. Maybe like 2 or 3 years ago, it finally made its way over into the US. And it's actually quite fascinating. It's just like an ultrasound technology. So we host a REMS technician in our location once a month, twice a month sometimes. Many OsteoStrongs have their own REM scan. And basically, it tells you a lot more information than a DEXA. would I say to get the REMS over the DEXA? The DEXA scan is covered by insurance, so I think that it's awesome that we just have um another type of measurement to validate your DEXA scan. Or, some people are like, this doesn't make sense. Like, I lost X amount of bone density in X, like, in a year. So it's just like, what's the word I'm looking for? Just kind of like gives them a second thing of data.
Mhm.
And so basically it's very quick. They scan your spine, and it's just with like this little like probe. So it keeps scanning your bone until it gets the perfect reading. So if you scan, say your L1 through L4 in your spine, you scan it and it gets a good reading of L1 and L2, but not the other two, it'll kind of come up as red or yellow on the machine. And so the technician will rescan it until it's perfect. Whereas a DEXA scan, from my understanding, is just kind of like a shot, like a picture of it, and then they kind of read from there. But I mean, a lot can happen in like the second that the picture is being taken. So it does your spine, your hip, and your femoral neck. And the printout, the results are so easy to read. It's very user friendly. Technician kind of prints it out, goes over it with you. It has your T score, of course, but it also goes a bit deeper to tell you the internal quality of bone that you're building and your fragility rate. So it'll actually tell you, in addition to the T score and the strength of your outer bone, what you're doing on the internal side of things, which is really where that
Problem
information will
is.
really like save
Right.
your life in the long term.
Yeah, great. So, I mean, we also run into this. Number one, the DEXA scan is not something you're going to do like every 2, 3 months or even 6 months.
Mhm.
Sometimes not even every year. And there's this phenomena. Number one, the technician who's doing the scan, the person who's reading the scan, the machine you did it on, and the sometimes lack of consistency and the lag of results,
Mhm.
right? So sometimes people come and say, well, it didn't change. You did, number one, you either did it too early. Number two, there's sometimes a lag of changes on the X-ray, and this is where talked about this before, the urine NTX test, which you measure the amount of bone metabolites that your kidney is filtering first thing in the morning. We take urine sample and we measure the amount of urine metabolites you're making. And let's say I put a patient on dose of estradiol. She's postmenopausal, and we use estradiol. And a year later, we check it and we see that the numbers change. And despite the DEXA scan not changing, we know for a fact that she is breaking down less bone, and it's a matter of time until we start seeing changes. So that is something very important to keep in mind when you're dealing with osteoporosis. Again, go back to the fact that it is not just treating the bone density, it's treating everything around it to make sure that you have the optimal and the best chance of survival if you basically fell or you're about to fall. So you mentioned briefly supplements, and what's your experience there with people coming in, expecting supplements, everything?
So I think supplements are a very oversaturated
Mm-hmm.
category right now. I do think that they're great if you are deficient in something, or if you're lacking some type of motivation in some sense, if you're not sleeping well, if you're not having energy throughout the day, there's some underlying issue for why that is. Um, when it comes to bones, I think a misconception is, I guess another question that I get a lot from our clients is, oh, well, my doctor said I need more calcium, so I eat cheese every day and I
Mm-hmm.
drink milk every day. And which, although, that it's good to get natural calcium and vitamin D, there are some really great supplements out there that will help with your bone building process. Of course, it's always good to get your blood checked and to see what you truly need. I don't think you should just go to the supplement store and just be like, I think I need all of this. It's very good to be like strategic, and also what supplements you take with each one. For instance, vitamin D and vitamin K2. You should take those together to help it kind of go through your body, and separating some in the morning and some at night. I know a lot of supplements kind of X out the other one. So I think there's not a lot of education for how much supplements are pushed out there. With that being said, we do have a supplement line. We partnered with AlgaeCal, which we actually brought it into our center because of the demand of our clients. I'm not a supplement specialist, so by no means do I know everything about them. So it's nice to have with AlgaeCal as an OsteoStrong member, you have your own supplement line to ask them any questions, and you're very honest. They'll be like, maybe you don't need the college, like the vitamin D here. You're getting it in a different supplement that you're already taking. Yeah.
Yeah, I mean, vitamin D, it is, I love vitamin D.
Hmm.
Majority of my patients are on vitamin
Yeah.
D one way or another, but vitamin D has a U-shaped effect. So vitamin D in appropriate doses, physiological doses, put it that way, or physiological levels is very helpful in bone remodeling and bone protection. But if you go super physiologic, actually, it could be a problem. It can enhance bone resorption, your parathyroid gland that has a lot of role in the osteoclast activity, and all that. So let me ask you this. So if you want people to get one message out of this, what is that one message that they want them to understand and learn from this hour of talk?
Yeah. I think the overall message is that your body can heal itself when it has the right resources to do so. And that doesn't have to be medication or in Western medication. It can be through nutrition and physical activity. And it's more than just a diagnosis. It's a whole lifestyle that you have to kind of commit to then feel your best and be able to do whatever you want to do for the rest of your life, right? So OsteoStrong is about reversing the aging side effects, just reversing aging in general. And it's so important to just know that there are holistic and natural ways that you can feel better outside of just traditional medication.
One myth about osteoporosis that if you can erase, what would that be?
That it's impossible to get rid of.
Yeah, but I educate that every day.
Hmm.
It's very possible to get rid of. I'm not trying to give advertisements to you or to anybody, but I think that exercise, smart supplementation, hormone replacement therapy is the smart answer, and it's 10 years from today, we're going to go back and watch this and see, well, we're trying to preach and convince
Hmm.
people that this is the standard of care. I'm going to bet you that 10 years from today, this is going to be the standard of care. And you're going to start seeing insurance companies actually reaching out to you to
Yeah,
cover your services. And
that would make all the difference.
yeah, it will.
Yeah.
The way I'm seeing this, so for the last decade, this longevity field and preventive care has been multi-billion-dollar industry, and so many people, I mean, there's obviously a lot of junk out there, but there's also a lot of truth and a lot of promise. And I think traditional medicine is starting to remodel to that and starting to change and adapt, because if you don't embrace it, you're going to be crushed. So they're trying to, possibly delay it as much as possible, because there's probably not enough data out there. But 10 years from today, there's going to be plenty of data, whether it's only osteoporosis or sarcopenia or whatever it is, you name it. You're going to see that preventive care and preventive medicine and whatever we're doing today, bioidentical hormones, all that, you're going to see it is going to be standard of care. The one thing I just want to comment on and end with the little comment you made a little bit ago about the Z score,
Hmm.
and how does that make you as a 75-year-old woman fit between 75-year-old women. And unfortunately, it's true, but unfortunately, it normalizes.
Hmm.
It normalizes that
Yeah.
you are going that route. You're going to have osteoporosis, and your bone is supposed to be thin at that point. Yes, it is supposed to be thin if you are not taking your hormone. Yes, it is supposed to thin if you're inflamed and you're diabetic and you're not taking your diet. So, if one thing I'd like to erase is get rid of Z scores
Yeah.
and some study, because the Z score is not just in DEXA scan; it's in a bunch of either some blood work has Z scores in it. Um,
That's very interesting.
yeah, because
Yeah.
that really
It normalizes where
normalize
they're
it.
at.
Now, obviously, there are ranges for, especially when we talk about blood work. There, growth hormone, for example. The older you are, you're expected to have less growth hormone. That's a whole different story. But when we talk about bone thinning is a problem,
Mhm.
right? It's going to be a problem, whether you're 75 or you're 45. It is going to be a problem. So, my message out there is, um, you cannot reverse aging. Aging is real, and we all are going to age and die. And there are some people out there trying to prove that wrong, and not my place. But you can mitigate the effects of it, and you can continue to have the best quality of life. Because I can't count how many times in the hospital an 83, 84, 85-year-old woman living independently by herself, great lifestyle, enjoying her last few years of life with family, pleasant. All of a sudden, she falls and breaks a hip. That'll be the end of it. It's not a pleasant end. It is an end where you are going to be in and out of rehabs, UTIs, pneumonias, and it's going to be, unfortunately, a likely miserable ending. Surgical interventions are helping, obviously, by having better techniques, better equipment, quicker recoveries. Still, the problem that is fixing the problem, and there's always a role for fixing the problem. But what we are trying to the message we're trying to get out there, you and I, is preventing bone loss and reversing it before it's too late should be the standard of care.
Absolutely.
Mackenzie, thank you so much.
Thank
This
you.
was very enlightening. I'm sure we're going to have you here again for more talks. I look forward to working with you.
Absolutely. Thank you so
All right.
much. This
Welcome.
has been awesome.
You're welcome. You're welcome.